Hey friends, welcome to Nursing Online Education. In this video, we will be discussing important question and answers of different nursing comparative examinations. Guys, let's get started. Here is our first question.
1. A nurse is reviewing a chest X-ray of a patient who has been diagnosed with pneumonia. Which of the following findings would be most consistent with this diagnosis? A. Clear lung fields bilaterally. B. Presence of a large mass in the upper lobe. C. Patchy infiltrates in the lower lung fields. D. Hyperinflation of the lungs. The answer is option C. Patchy infiltrates in the lower lung fields. 2. A 55-year-old smoker presents with a persistent cough and shortness of breath. A chest X-ray reveals a flattened diaphragm and increased lung volume. Which of the following conditions is most likely to be present? A. Pulmonary embolism. B. Chronic obstructive pulmonary disease, COPD. C. Tuberculosis. D. Acute asthma exacerbation. The answer is option B. Chronic obstructive pulmonary disease, COPD. A. 3. A nurse is preparing a patient for a chest X-ray and provides instructions on what to expect during the procedure. Which of the following statements by the nurse is accurate? A. You will need to lie flat on your back during the procedure. B. You will be asked to take a deep breath and hold it for a few seconds while the X-ray is taken. C. You should avoid eating or drinking for at least 12 hours before the X-ray. D. You will need to remain completely still for at least 10 minutes during the procedure. The answer is option B. You will be asked to take a deep breath and hold it for a few seconds while the X-ray is taken. 4. A nurse is preparing a female patient for a chest X-ray and suspects that the patient might be pregnant. Which of the following actions is the most appropriate? A. Proceed with the chest X-ray and document the patient's pregnancy status afterward. B. Ask the patient if there is any possibility she could be pregnant and proceed accordingly. C. Have the patient undergo a pregnancy test before the X-ray procedure. D. Delay the X-ray until the patient's next menstrual cycle. The answer is option B. Ask the patient if there is any possibility she could be pregnant and proceed accordingly. 5. A nurse is preparing to collect a sputum sample from a patient suspected of having pneumonia. Which of the following is the most appropriate instruction to give the patient before collecting the sample? A. Rinse your mouth with mouthwash before collecting the sample. B. Take a deep breath, cough forcefully, and expectorate the sputum into the container. C. It's best to collect the sputum sample after drinking fluids to loosen it up. D. Wait until after you have eaten your meal to collect the sample. The answer is option B. Take a deep breath, cough forcefully, and expectorate the sputum into the container. 6. A patient has been asked to provide a sputum sample to evaluate for tuberculosis, TB. Which of the following findings on a sputum culture would most strongly indicate a diagnosis of TB? A. Presence of white blood cells and normal flora. B. Presence of acid-fast bacilli, AFB. C. Large amounts of green, thick mucus. D. Negative culture for any microorganisms. The answer is option B. Presence of acid-fast bacilli, AFB. 7. A patient is recovering from a bronchoscopy. The nurse is monitoring the patient for complications. Which of the following signs would indicate a potential complication that requires immediate attention? A. A slight cough with pink-tinged sputum. B. A mild sore throat that improves with throat lozenges. C. Persistent hemoptysis and a drop in blood pressure. D. A mild fever that resolves within a few hours. The answer is option C, persistent hemoptysis and a drop in blood pressure. 8. A nurse is caring for a patient after a bronchoscopy procedure. The patient is awake and alert but reports feeling a slight sore throat. What is the most appropriate action for the nurse to take? A. Reassure the patient that a sore throat is a common side effect and should improve within a few days. B. Administer a pain medication to manage the sore throat and monitor the patient for bleeding. C. Immediately assess the patient for signs of a pneumothorax. D. Offer the patient fluids and provide throat lozenges for relief. The answer is option A. Reassure the patient that a sore throat is a common side effect and should improve within a few days. 9. A nurse is preparing a patient for a thoracentesis procedure. The nurse should instruct the patient to assume which of the following positions to facilitate the procedure. A. Lying flat on the back with the head of the bed elevated. B. Sitting upright on the edge of the bed, leaning forward with arms resting on a table. C. Lying on the affected side with the head of the bed elevated. D. Lying on the unaffected side with the head of the bed flat. The answer is option B, sitting upright on the edge of the bed, leaning forward with arms resting on a table. 10. A nurse is educating a patient about the transmission of tuberculosis, TB. Which of the following statements by the patient indicates an understanding of how TB is transmitted? A. TB is transmitted through direct contact with an infected person's blood. B. I can catch TB by sharing eating utensils with someone who has it. C. TB is spread when an infected person coughs, sneezes, or talks, releasing droplets into the air. D. I can catch TB by touching surfaces that have been touched by someone with TB. The answer is option C. TB is spread when an infected person coughs, sneezes, or talks, releasing droplets into the air. 11. Which of the following is the most effective strategy to prevent the spread of tuberculosis, TB, in a community setting? A. Encouraging the patient to rest in bed for the first few days of treatment. B. Isolating the patient in a single negative pressure room. C. Providing over-the-counter medications to manage cough and fever. D. Encouraging patients to continue taking antibiotics for 1 week after symptoms subside. The answer is option B, isolating the patient in a single negative pressure room. 12. A nurse is explaining directly observed therapy, DOT, to a patient who has been diagnosed with tuberculosis, TB. Which of the following statements by the patient indicates a need for further teaching? A. I will need to take my medication exactly as prescribed, and a healthcare provider will watch me take it. B. DOT ensures that I take my medication correctly and consistently to help prevent resistance. C. I can skip doses of my medication if I feel better. D. DOD helps make sure I complete my TB treatment and reduce the risk of transmission. The answer is option C. I can skip doses of my medication if I feel better. 13. A patient diagnosed with tuberculosis, TB, is prescribed a combination of medications including isoniazid, INH, rifampin, pyrazinamide, and ethambutol. Which of the following is a priority nursing action while the patient is receiving this treatment? A. Monitor the patient for signs of liver toxicity, such as jaundice or dark urine. B. Educate the patient that rifampin will cause their urine to turn bright red. C. Ensure the patient's blood pressure is maintained above 130/80 mmHg. D. Instruct the patient to stop the medication immediately if they develop joint pain. The answer is option A. Monitor the patient for signs of liver toxicity, such as jaundice or dark urine. 14. A nurse is caring for a client with COPD. The client reports increased shortness of breath and a productive cough with green sputum. The nurse notes that the client's respiratory rate is 28 breaths per minute and their oxygen saturation is 89%. What should be the nurse's first action? A. Administer a bronchodilator as prescribed. B. Increase the oxygen flow rate to 4 liters per minute. C. Call the healthcare provider for a prescription for antibiotics. D. Assess the client's lung sounds and respiratory effort. The answer is option D. Assess the client's lung sounds and respiratory effort. 15. An elderly client with pneumonia may appear with which of the following symptoms first? A. Altered mental status and dehydration. B. Fever and chills. C. Hemoptysis and dyspnea. D. Pleuritic chest pain and cough. The answer is option A. Altered mental status and dehydration. 16. A nurse is caring for a client with COPD who is on oxygen therapy via nasal cannula at 2L/min. The client's oxygen saturation drops from 94% to 88%, and they are showing signs of increased dyspnea. What is the nurse's first action? A. Increase the oxygen flow rate to 4 liters per minute. B. Switch the client to a non-rebreather mask at 10 liters per minute. C. Increase the oxygen flow rate to 3 liters per minute and reassess. D. Notify the healthcare provider immediately. The answer is option D. Notify the healthcare provider immediately. 17. A nurse is assessing a client with chronic bronchitis. The client has a persistent cough with sputum production and dyspnea. Which of the following findings would the nurse expect when assessing the client's respiratory status? A. Increased respiratory rate with shallow breathing. B. Barrel-shaped chest and hyperresonance to percussion. C. Productive cough with copious mucus and wheezing. D. Dry cough with no sputum production. The answer is option C. Productive cough with copious mucus and wheezing. 18. A nurse is educating a client with cystic fibrosis, CF, about the importance of increasing their fluid intake. Which statement by the client indicates an understanding of the teaching? A. I should drink more fluids to help thin my mucus and make it easier to clear from my lungs. B. I need to drink fluids only when I feel thirsty, as drinking too much could lead to fluid retention. C. I can reduce my fluid intake if my mucus production decreases. D. Fluid intake should be limited because it can cause swelling in my lungs. The answer is option A. I should drink more fluids to help thin my mucus and make it easier to clear from my lungs. 19. A nurse is teaching a client with cystic fibrosis about the use of pancreatic enzymes. When should the client take their pancreatic enzyme replacement therapy? A. Take the enzymes with each meal and snack to help with digestion and nutrient absorption. B. Take the enzymes on an empty stomach to enhance their effectiveness. C. Take the enzymes only in the morning before breakfast for the best effect. D. Take the enzymes after meals to ensure proper digestion. The answer is option A. Take the enzymes with each meal and snack to help with digestion and nutrient absorption. 20. A nurse is caring for a client who has been prescribed albuterol for asthma. The client reports experiencing palpitations and an increased heart rate after using the inhaler. Which of the following is the most likely cause of the client's symptoms? A. Hypokalemia caused by albuterol. B. Tachycardia as a common side effect of albuterol. C. A hypersensitivity reaction to the medication. D. A drug interaction with the client's other medications. The answer is option B. Tachycardia as a common side effect of albuterol. 21. A nurse is teaching a client how to properly use a metered dose inhaler, MDI, with a spacer. Which statement by the client indicates an understanding of the proper technique? A. I should exhale deeply before using the inhaler and then inhale as I press down on the canister. B. I should shake the inhaler before each use to ensure the medication is evenly mixed. C. I should hold my breath for at least 5 seconds after inhaling the medication. D. I can use the MDI without a spacer if I prefer, as long as I get the medication in my mouth. The answer is option B. I should shake the inhaler before each use to ensure the medication is evenly mixed. 22. A nurse is educating a client with chronic obstructive pulmonary disease, COPD, about the importance of vaccination. The client is concerned about getting the flu vaccine and asks the nurse if it is really necessary. Which of the following responses by the nurse is most appropriate? A. It is important for you to get the flu vaccine every year, as respiratory infections like the flu can worsen your COPD and lead to serious complications. B. You do not need the flu vaccine because COPD is a lung disease, and the flu vaccine does not protect against respiratory illnesses. C. Since you have COPD, you should only get the flu vaccine if you are exposed to someone with the flu. D. You can get the flu vaccine, but only if your COPD symptoms are stable and you are not experiencing any flare-ups. The answer is option A. It is important for you to get the flu vaccine every year, as respiratory infections like the flu can worsen your COPD and lead to serious complications. 23. A 22-year-old client with asthma presents to the emergency department, ED, with complaints of increased wheezing and difficulty breathing. The nurse notes that the client is using accessory muscles to breathe and has a peak flow reading of 60% of their personal best. The client has used their rescue inhaler, albuterol, but reports no relief. What is the nurse's next best action? A. Reassess the client in 30 minutes to evaluate the response to the inhaler. B. Administer a nebulizer treatment with albuterol and assess the response. C. Provide the client with a sedative to reduce anxiety. D. Discharge the client with instructions to use their inhaler more frequently. The answer is option B. Administer a nebulizer treatment with albuterol and assess the response.
Thank you for watching.